But first, let's bring in a Bay Area lawmaker who held a town hall on that very topic earlier today with State School Superintendent Tony Thurmond. State Senator Steve Glazer joins us now. Senator Glazer represents part of Contra Costa and Alameda counties. Thank you for your time, Senator Glazer.
It's great to be on your show. Thank you.
It's great to chat with you. Now, today, Superintendent Thurmond told you, I heard part of your town hall, that if schools were to open tomorrow, most of them should be distance learning. Now, that is a more direct and kind of a different tune than what he had sounded before. What's changed?
Well, certainly the infection spreading throughout our state and most places in the state has made all of us stand up and wonder if we're going to say it's not safe to be inside of a restaurant, dining, why would we think it's going to be safe inside of a classroom with the kids and with a teacher? And so I think that the spread of the virus, I think it's caught our state leaders by surprise. And I think there's a reevaluation going on at every level, including whether or not our schools are safe for our kids to go back to.
Well, it is kind of a political battle, as you know. Just today, White House press secretary saying President Trump wants schools to open. She said when he says open, he means open and full. Kids being able to attend each and every day. The science should not stand in the way of this. That was her quote, although later on she did say the science is on our side here. What is the science that you're looking at?
Well, I'm not a public health expert, but I do consult with them and we hear from them, and you have heard from them as well. And the test should not be because I want one thing or another to happen. It should be, is it safe for our kids, for our community? That should be the standard. So none of us like to see political dictates from any direction, left or right. We want to make choices, right, based on science and data. And all the data points to the fact that the virus is spreading throughout California. We have not flattened any curve. In fact, the trajectory is only up as we see it today. And so why would we want to put anybody in jeopardy in those circumstances? So I was happy to see the superintendent of schools today be clear about it, that he recognizes virus spread. Listen, it's as personal as, would you send your kids to school under these circumstances? Or would you teach in a classroom full of kids and feel like you would be safe? And I think when you look at it from that basic level, I think you are questioning whether it's the right thing to do. Now, the fact of the matter is the governor up until now has said all the school districts get to decide for themselves. So I have 19 school districts in my district, and they're all deciding for themselves. And it's quite a quandary because they are not public health experts. They're trying to do what's right. They know in classroom education is the best. A teacher in front of the room working with kids is the best. And I think they recognize, and we do as well, that distance learning is not the best education. But
you do make a good point, right, that these school board members who are doing the deciding are not medical doctors for the most part. Yet they're having to make these choices district by district, leaving the teachers and the parents to kind of argue over fighting these painful battles, in some cases people tearing each other apart, minus the framework of an overall structure that's very clear. Guidelines that spell out, hey, if your county has these numbers and this is your trend, then you start with distance. And then if you want to move into the next phase, these are the numbers you have to have. So do we expect that to come out tomorrow? Because we do know Governor Newsom is going to offer, I don't know if we should call them guidelines or if they're mandates tomorrow. Maybe you can tell us more. We know he's going to say something about how to reopen schools. What do you know?
Well, I'm hoping that they are going to be standards and not guidelines. He's used the guidelines routine for the last 2 months, and it hasn't worked. And we've seen where you've given that leniency to counties that it hasn't been engaged in with the best of responsibilities. So I'm hoping it's going to be a clear standard for what would be considered unsafe for our kids. And that will be a statewide mandate, but we'll wait and see tomorrow.
How important is that to have very specific metrics and rules that they have to meet in order to say they want to do hybrid or they want to do in person? Because if you don't have that, doesn't that leave the districts liable to accusations that they weren't watching out for safety, things like that?
I think that it does. I think we want standards because we want them to be based on health and safety. And that's why I hope that's what the governor does do. But here's something else that's equally important, is that we're fighting this COVID-19. It's going to be an up and down fight for many months ahead. And what we really need is for the public to have trust in the decisions that are made, the standards that are set. and know that if you're on one side, it's good, the other side, it's bad. And so when decisions are changed locally or statewide, people understand why they're changing. And that means that they'll have trust in that next decision that comes and the next one after that. So this issue of credibility is broader than just the school's decision. It goes to the whole broader question of how we're fighting this virus. And credibility is very important for building public trust.
Well, do you think when these recommendations or mandates, let's hope they veer more towards the mandates, that do come out tomorrow should be specific, like age specific, right? For example, looking at the data and the science, if it does show that, for example, younger kids under 10 are less likely to get sick or be transmitters, then maybe they could be taught in a different way, maybe a little more in person for them, you know, because right now it seems like it's an either or. It's an in-person or remote. You know, we don't seem to be looking at the nuances or breaking them down.
Well, I think you're right that different age groups are able to deal with different circumstances, whether that's remote learning or in-classroom learning. But here's the thing, fundamentally, it is about safety and health. And I'm not so sure there is any age differential. And by the way, even though younger people may not die from COVID-19, at least based on what we know today, they can get awfully sick. And they can infect older people who are at much greater risk of death. So I hope that the standard may be based on age for the type of remote learning that goes on or is allowed. But I hope that there's not necessarily an age break for what's considered safe.
Now, obviously, you care a lot about schools, but also about the businesses, especially the small businesses in your district. I got to ask you, you've been saying, and I'm reading in your op-eds, that there's been too much local control, right? How has that been impacting the businesses in your district?
Well, we have here in the Bay Area standards that have deviated by county lines, and most people don't even know where that county line begins and ends. A lot of what we did right in the Bay Area was our public health officers from the 6 counties in our area, plus the town of Berkeley that has their own public health office, coordinating together the decisions to shelter in place together, the standards to establish for what's an essential business and the rest. They did all that together. But as soon as the state stepped in with variances and guidelines that allowed counties to reopen, then they diverged and they all went in their own direction. And so that's why we have the situation of neighborhoods, one next to the other, with different rules and requirements. And it's created a lot of confusion. And it's also created an inability to control spread. If you have a spread in Contra Costa and someone can drive a half a mile into Alameda County to go to an outdoor restaurant, what have you done to create a safer circumstance? And so we're all in this together. I think the decisions from the state are important. And I also think that they be done on a regional basis so that you don't get these conflicting standards. You know, most people don't know where their city lines start and end. And the same thing with school districts, by the way. They're in their own bubble, and what they decide in that bubble doesn't mean it stays in that bubble. Those kids go home, they go and hang out in neighborhoods or with friends around the corner. There's a cross-pollination that occurs, and it's not that it doesn't, and it means that what seems like a good choice for one entity breaks down completely. And I think we've seen that in the Bay Area.
All right. Yeah, no. And you are not shy about saying California's COVID strategy failed. In your op-ed on July 3rd in the Sacramento Bee, you say Newsom said his delegation of authority to the counties was necessary to save the state's economy. But in doing so, he accepted the false premise that we must choose between public health and commerce. In fact, there is no choice. Explain that.
Well, here, and it goes to the school issue as well. If we can't contain this virus, nothing else can go forward. Your business can't reopen. Your kids can't go back to school. That really, we have to stay focused on the fundamental issue before us. We have to contain the spread of this virus. And so for my friends in the business community, people who have been hurt because they've lost their jobs because a business is closed, listen, we care about you. This is a very difficult circumstance for you, but we have to contain this virus. Otherwise, we're going to have the deja vu all over again. We're going to shut down, and then we're going to open up and it's going to spread. We shut down, and no one wants that back and forth, which is also creating enormous disruption for business. We have to contain this virus.
Well, we only have 30 seconds, but I got to ask you, based on what I'm hearing from you, are you saying we could shut down now and we should shut down now the way we did in mid-March?
The virus is out of control. We have more infections today than we had in March. Our hospitals are filling up, overflowing in certain parts of the state. No one likes the idea of sheltering in place. Great hardship comes from it, but it is the only path forward that I can see to killing this virus. Unless our testing, our track and tracing can be dramatically improved, our only choice is closing down again and trying to stop the spread and actually trying to flatten the curve, which has never been done in California yet.
Senator Glazer, I just have to point out to our viewers, you are a Democrat, and few have gone this far in criticizing Governor Newsom's approach thus far. No trepidation at all in saying what you're saying?
Well, I think he's done a very good job, by the way, in a lot of the choices he's made. In the case of reopening too quickly, we have a difference. It's not meant to be personal. His staff and he have worked tirelessly and done a number of really great things. But listen, it's a life and death choice. I want to be out front about the choices and hopefully guiding him constructively to what I think is a better path.
All right. Well, we'll see what that path may look like when we get his guidelines tomorrow, or mandates, hopefully more on the mandate side regarding the reopening of schools. Senator Steve Glazer, thank you so much for your time. Take good care.
Thank you very much.
All right, folks, we'll take a short break on the air. When we come back, we'll talk with Dr. Alok Patel about COVID-19, including this very topic of safely returning to school. All right, Facebook friends, thank you for joining today. Wow, I'd like to hear your comments, see what you had to say. Steve Glazer, state senator, talking to us about his belief that yeah, all right. That's my producer talking to me. See, I wear a little earpiece. And he's summarizing some of your comments that he's been following closely. Very divided on opening or closing schools, which, of course, that same battle is being fought in every district, and precisely because opinions are so divided. I think Steve Glazer's point is that we need guidelines guided by data, and that, in fact, I shouldn't say guidelines because I think he wants to go further than that. Specific metrics that should be used by every district. That's not to say one size fits all. That's not to say every single school district needs to do the same thing, but it is saying they should use the same protocol. That is, if two districts are looking at the same set of numbers, have the same resources, same ability to space out, they shouldn't be making two different decisions. And that is what a lot of people are now saying, from school districts to teachers to parents. So we'll see what the governor puts out tomorrow. All right. Dr. Alok Patel is up next. Hello, Dr. Patel.
Hi, Kristen. How are you?
Does that summarize how everyone's feeling right about now? Give me a thumbs up on Facebook if that's how you're feeling too. How are you feeling?
I'm a combination of anxious and frustrated, and I'm just going to say this, a little angry about the direction things are going with respect to communication and where the data is going and what people are doing. It's just, I'm trying to stay optimistic though. I'm trying to stay optimistic.
Yeah. No, we got to stay optimistic. That is a good point, but it is getting a little hard. This is true. All right, we're coming back on air in 15 seconds. So folks, send in your questions for Dr. Patel, okay? I'll try to keep an eye on it and see if I can ask a couple of them. Hi there. We're back with the state rolling back reopenings for businesses. Cases and hospitalizations surging in California. Some news about vaccines as well. There's a lot to talk about. So joining me now is our special correspondent, Dr. Alok Patel. Dr. Patel, good to see you again.
Good to be here.
All right, I want to start with schools. We just had a conversation with Senator Steve Glazer, hoping for mandates or very specific metrics that Governor Newsom may release tomorrow about how schools should reopen, like what they should be looking at, you know, deciding, oh, this is where we're at in our county and in our area, so we can go ahead and do this. What is your thought with regard to how schools should reopen when they look at the COVID in their county, in their district?
Well, I think the first thing is it is not an all or nothing solution. It is not a one size fits all, which I think is where the national conversation was a couple of weeks ago. So I actually do stand with the fact that counties should be looking at their specific numbers, their cases. They should also be looking at their specific school districts. You have to think about resources, infrastructure, your faculty, your teachers, the age? Do you have a backup plan? And then you have to look at your student population. There's so many variables to take into account. And then even within those variables, you can't have the same type of guidelines or distancing for a senior in high school as you would for a first grader or second grader. So there's a lot of things that need to be taken into account. So I do think that is a good approach to kind of have some type of metrics so different school districts can really take a look at them and say, this is what works for us.
Right. If you have a school in a district that is not on the watch list, all right, and they have lots of space where they can spread out and keep to under 12 kids in each class and hold a lot of them outdoors. And if they're under 10 years old and the teacher is young and healthy, would you say, I feel comfortable with that?
In theory. I'm saying in theory because I would also want to know the specific measures the school is taking with respect to how are they designing their classrooms? Do they have unidirectional hallways? What are they doing about ventilation in the windows? I would also want to know that the parents themselves are not engaging in any high-risk behavior, that they're also a population that has adequate testing, and there aren't any risk factors associated with the faculty. I mean, there's things that I would want to know specifically from the school itself as well. And then even then, it's possible they may be staggering classes. They may have some classes with teachers and others that are distanced or some type of hybrid model.
Okay. I want to also move on to businesses. Specifically, I don't know if you heard today, but salons are making a push to ask the governor, can we please operate, hair, nail, if we are outdoors, if we take our services outdoors. What is your thought on that? Are you comfortable? Obviously, with, manicures, you're very close to your manicurist and the client. But if both were masked and both don't have fevers or any other symptoms, and they're doing this outdoors, is that an option to allow this whole sector of small, business providers, vendors, and a lot of people who are women, quite frankly, in these jobs to start working again?
I feel the frustration for everybody, especially the businesses who are doing everything right. Now, going back to your question where you said, is it feasible if they're outdoors and they're following every single guideline? In a perfect scenario, yes, it is feasible. But here's the problem. There's things that these businesses can't account for. So for example, if you open up your hair salon or you're doing nails or a gym or whatever it may be, you may be following all the rules. The problem is that we have cases going up in every single county around San Francisco County. And we have to actually look at what the public is doing because one slip up from somebody else might jeopardize your business. It's not fair. And it's actually very frustrating for a lot of people out there. I cut my own hair and I offered to my wife, I'll cut your hair too because things are just shut down right now.
Does she say no thanks?
She said, God, no. But, I say that in jest, but in reality, I do think business owners, just like healthcare professionals, need to hold people accountable who are not following the guidelines because they're jeopardizing the entire economy.
I get your point. And by the way, your hair doesn't look that bad. So, I would suggest to your wife, just give it a shot. A lot of people, I've seen comments like, hey, why are we keeping these things closed, especially schools, right, when the mortality rate doesn't seem to be that high? And I don't know what that person's definition of high is, but tell us what the mortality rate seems to be. But also, I know you keep telling us to think about the morbidity, too.
That's right, Kristen. So again, I've said this 1,000 times, and I do think that reopening of schools is going to be some type of priority. But I don't think that when it comes to the argument of for or against opening or closing businesses, people can focus solely on the mortality. So if you say right now that the mortality to coronavirus, meaning the percentage of cases where people die is under 5%, that on its own sounds like great news. And it could be lower as we find more cases. But the morbidity is still up there. People are being hospitalized for weeks at a time. There's people who have had strokes, have long-term breathing problems. If they have any other chronic illnesses, those are being affected as well. So just because you live does not necessarily mean that you haven't had a huge detriment to your life or that hospitals aren't hitting a max capacity. So people need to really look at both of those features, long-term illness from coronavirus in addition to the deaths. You can't just say it's not just black and white. You don't just either die or get coronavirus and you're fine and live on your day. There are a lot of people who are getting really sick from this.
Got it. All right. Hey, I want to bring in some viewer questions. Vernon Marcaida wants to know, can the virus be transmitted on clothing?
It could be transmitted on a clothing, depending on how much of the respiratory droplets you got on your clothing, or if you happen to work in a high-risk scenario. For example, when I come home from the hospital on certain shifts, I change my clothes in the hallway in this apartment building in a paper bag because I don't know what droplets are on that clothing. But when in doubt, it's best to take your clothes off, wash them before coming in contact with anyone else. Now, when I say respiratory droplets, we don't know how much of that is actually going to be transmissible or contagious, but when in doubt, don't let your clothes come in contact with anyone.
All right. Good advice. I want to ask you about vaccines. We've heard of a couple of different ones, a bunch, in fact, but there's one out of the University of Oxford in particular. They're saying they could be through human trials in September, and that AstraZeneca has lined up agreements to produce 2 billion doses. Is this the one that we've been waiting for, you think?
One of the ones we've been waiting for. So I think what's really exciting is not necessarily what you just mentioned with the AstraZeneca vaccine, but we have to look at the fact that there are about 155 vaccines that are in some stage of production right now. And then there's a few that are heading towards, hopefully, phase 3 trials later in July or September. And what I'm saying, what I'm thinking is that if there's multiple shots on goal, we just need one or we need a couple. Now, even in the perfect scenario, we may not see a vaccine until early or mid next year, but I think it's going to be really crucial to really look at the data in September to say, okay, we know these vaccines have created a little bit of an immune response in phase 2 trials. In phase 3 trials, we want to know now if that immune response can protect people from coronavirus or lessen the severity of an infection compared to placebo or people who don't get the vaccine. So I think it's going to be a really exciting time this fall to look at those results and see where we're at. That vaccine is what we need for phase 4 to get back to some form of normal.
All right. We're going to take a short break on the air, but our conversation with Dr. Patel continues on our live streams right now. All right, Dr. Patel, I heard something about hydroxychloroquine today. As you know, that is the one that had been touted by the president as a therapeutic. Some study today that showed that it may not be as effective. What do we need to know about it?
Is what you just said. So
okay.
Hydroxychloroquine has now turned into this roller coaster on headlines. I swear every 2 weeks there seems to be something else coming about it being effective or not being effective. I think the bottom line for the public to know is that hydroxychloroquine is not something that you're going to take as an outpatient away from a hospital. It's not something that you need to try and go and ask to get prescribed or something that you're going to take to prevent coronavirus. Hydroxychloroquine right now is only being used in select hospitals under certain trials with close cardiac monitoring. It's IV and it's for very specific scenarios. So I would urge people to not look at headlines and kind of make their own assumption. You really want to talk to your doctor if you're concerned about anything or if you have any questions, and not try to go and self-medicate or try to kind of find your own solutions with this. Hydroxychloroquine is becoming the new soap opera when it comes to medications right now.
No, that is so very true. So we were just talking about vaccines, and I'm wondering, have you seen any studies that indicate when we do get one that is effective and safe and all that, what is the percentage of people who might be willing to take it?
Oh, this is a great question. I haven't seen any formal studies, but there's a lot of people talking about comparing this to the flu vaccine or to other vaccines, and people are concerned and saying we might only see 60 to 70% of Americans actually go and get the coronavirus vaccine when it's available. When it's available. Now, one thing I have to mention though is that people have seen how devastating COVID-19 really is, and so.
All right, hold on one second.
Okay.
We're coming back on air. All right, we are back with our special correspondent, Dr. Alok Patel. We were chatting during break as well. Want to go through some rapid fire questions for you, Dr. Patel. Would you do this? Would you do that? Because even at this point, and with more people being conscious of the surge that we're having, they want to know, are these activities risky? So real quickly, eat outdoors, yes or no?
Sure, maybe. Depends on the restaurant. It's not yes or no.
Okay. If you prefer, we can go with a low risk, medium risk, high risk. Okay. Exercise without a mask. Exercise without a mask?
Where are you exercising?
On the beach.
Low risk.
On a popular trail that a lot of people visit?
Medium risk.
Okay. Swim in a pool with other people. Public pool.
I would say medium to low, depending on how many other people are in the pool with you. There's variables to all these scenarios.
I know. Gathering with 6 friends out in your backyard.
Medium risk, depending on how crazy your friends are.
Okay. Playing golf or tennis.
That I would say is low risk, especially because of how isolated you could be. But I don't know if you're going to be playing golf or tennis with a crowd of people in that golf course.
All right. Having dinner at somebody's house in their dining room.
High risk, depending on how many people there are. We've actually seen outbreaks traced to dinner parties or gatherings of people who don't live in the same household.
Okay. Well, spending an hour at a playground.
That's probably low risk.
Okay. Hugging or shaking hands when greeting a friend. I think I can guess this one.
I'm going to say high risk. Who's this friend? Are they a shady individual or are they someone you trust?
I don't know. Someone super careful. No, traveling by airplane.
That still has to be high risk right now because different airplanes, different guidelines. And remember, you can't control for what your passenger may or may not be doing.
Okay. I think we have about 40 seconds left. I got to ask you, what do you think is the impact of hospitals now being directed to direct their data to the HHS, basically the Trump administration, as opposed to the CDC? What does that mean for us? What can we no longer find out, or can we still find out and it doesn't really make an impact on us?
So I'm hoping for us, it doesn't make an impact because from what I understand and what I read this morning, the CDC can still access the data. What I'm worried about, which we may see a little bit downstream in a couple of weeks, is the White House is potentially not fully utilizing the CDC's expertise. The CDC needs to see this data. They need to be giving the public daily press briefings on what they're learning and what they're doing. You know, part of the frustration coming out right now is people are left in the dark. People don't understand where these decisions are coming from, what's true, what's not, and what the numbers mean. And that's what the CDC, that's what these experts really are for.
Thank you, Dr. Patel. Out of time for now. We'll continue this conversation on our live streams. Okay. I want to give you a chance to finish that thought because, you know, people are kind of concerned. And you said it's really downstream when we'll really start to feel the impact.
With regards to the CDC data?
Yeah.
We'll look at, I mean, we have to look at what's happening right now. And, you know, we are not getting consistent briefings about what's happening in the country. We're getting these second and third party reports. People don't know what to trust and what not to do. And if you look at every other major outbreak or pandemic this country's gone through, most recently, if you look at H1N1 in 2009, the CDC was giving nightly briefings. The acting director at the time, Richard Besser, was on air every single night giving briefings. And that's kind of, we've lost that touch with our major public health arm right now. And so, you know, people are concerned if the data is going to the White House, they say, HHS says it's going to be easier for hospitals to report the data, but I'm not hearing that from the hospitals. The hospitals are saying they're very concerned with what data is going to actually get out to the public, what the decision making is going to be. Are they going to be able to lobby for PPE and ventilators in the same way they were in March? I think there's a couple unknowns here. The CDC is trained to do this. This is what they do. So they should be the ones really taking the data and running with it.
Okay. I want to get in a couple last viewer questions from Facebook before we say goodbye. What's the risk level of children who have diabetes or asthma?
I would put them in the higher risk category and compare it to other children. I can't give you a specific number there, but we don't yet know a lot about what the higher risk children, how they're going to react to coronavirus. And, you know, we looked at things like multi-inflammatory syndrome, which you have an additional risk factor if your child has another illness. And that's something else that should be built into the reopening schools plan. You know, if children have another illness, or if they're on immunosuppressants, for example, what's the plan for them? Can they do some type of staggered learning? Do they have a different classroom they can go to? How can they isolate? So I think that is something that parents should really be cognizant of as fall comes around.
All right, you've given us good information and things to think about. Dr. Alok Patel, thanks so much for joining us. I'll see you again soon.
Thanks for letting me rant.
No problem. That's what we're here for. All right, welcome back. Thank you so much for joining us on this interactive show, Getting Answers. Today, we heard from Senator Steve Glazer, who represents Contra Costa and Alameda counties. We hope to hear more from Governor Newsom tomorrow with regard to the reopening of schools. Thanks for joining us. See you tomorrow. Bye-bye. All right, thank you, Facebook friends. Thank you for your great, engaging questions today. See you later.